Hi, Jenny here. Today is still Monday, January 29th. I just thought I'd get this other one filmed right away while I was at it. So you know from my last video that one, I was told that I was in remission from the cancer, so yay, so excited about that. And then, as I said, I celebrated by going to the ER. So on, sorry, that right shoulder is still really hurting. On the 17th, I had my oncology appointment where I found all that out, that, you know, I'm officially in remission. And on the 18th, by that night, I was in the ER. So I was having stomach pain, even at the oncology appointment. I was having stomach pain in the morning. Usually I figured it was just gas, it was going to pass. And by that night, it was still kind of hurting. Thursday, I thought I would film a video, and again, it was just off. I was in pain. Stomach was just hurting. The gas wasn't passing, and all that. So hubby got home from work. You know, could tell I was uncomfortable. You know, he himself kind of did some research, looked up some stuff, thinking, all right, you know, what's going on? What could possibly be happening? And you know, mentioned as far as throwing up or anything, and I said no, I wasn't throwing up, didn't have a fever, it was just all the pain. Well, by 9 o'clock I went to the bathroom and I started dry heaving, and he's like, can I take you to the ER, because that's one of the symptoms, signs of having a blockage. And then, yeah, much as I don't want to, it's not going away. And then with the dry heaving, I'm like, yeah, let's do it, let's go to the ER. So we went to St. Luke's, where my surgeon is based, which was a good decision. It's like, okay, which hospital are we going to go to? Like, let's just do that one just in case there's a problem, and then the surgeons are right there, and they can check up on me and everything. And so that was good. Got to the ER, they were very busy, very nice. The staff was all, they didn't seem stressed or anything. They were just very, what do you say? Just kind of methodical, you know, getting through what they need to get through, doing, you know, your check-in type stuff. Then we had to go sit for a little bit, then we got called up to the nurse, and they did the vitals and took some more information as far as, you know, what was going on, and then sat in the ER again for probably half an hour. Thank goodness they had like one double-seater type chair, so I nicely took myself to there. I brought my pillow with me, you know, so I was sitting on that, and I could lay down on that one. I put our coats as a pillow, and laid there for like about half an hour, and they called me back, got me into a room, which was very nice. It was actually a room, and checked me out. The doctor saw me and said, yep, they're going to do a CT scan on me, seeing as that was what, when I called in on Thursday during the day, I messaged my surgeon, or actually her PA, and said, hey, this is what's going on. It's like I've had a little bit of output, I've had a little bit of gas coming through, but I'm in pain. And so he called, and then he said that, well, it seems like everything should be fine. There shouldn't be a blockage if you have stuff coming through, but we'll order a CT scan for you. And they had not called yet that night, because this was like 4:30 in the afternoon or something. Scheduling hadn't called me at all, figuring I'd get that CT scan done Friday. Well, so Thursday night, being in the ER, it was like, okay, we'll do a CT scan. So got that done, and that did show that there was a blockage in my small intestines. And so protocol is that you get an NG tube. So I've never had an NG tube before. The universe wanted me learning more things. So they put the NG tube down. They said they were going to numb me up. They're going to do whatever. They didn't. They rolled around the end of the tube in some type of analgesic. It's not really going to numb you as it's touching you, you know, I don't think it's that good. But as they got the NG tube down part way, it got to the gag reflex point, and then I started gagging. They're like, they had given me a cup of water. They're like, okay, sip on the water, you gotta swallow. And I was just gagging, and I'm trying to swallow. Yeah, it's good, swallow. And I'm like, I just tried swallowing because I was just gagging. And they got the tube down. Well, I think because I was gagging so much, they scratched a part of my throat, so right in here. Unfortunate for me. So they got the tube down, it gets hooked up to a canister, and they suck out your stomach contents. Which, you know, there wasn't much, but they started with that. They admitted me to the hospital, but there weren't any rooms available. So I guess there were about 39 patients that were waiting for rooms that were admitted. And at least, thank goodness, they said, again, my angels were watching out for me, that they got me a room, because some patients were actually just in the hallways and they didn't have a room at all. They were just there. So, yeah, I had the room, and then, let's see if I wrote notes because this was a long stay. I was in the hospital for a week, so let's see. They did an EKG. I thought too, I guess maybe, you know, in case they wanted to do surgery or whatever. They did a chest x-ray also, just to make sure that they had the line in the right place. They do a thing where they listen to make sure it was where it was supposed to be, and it should have been. But now they did a chest x-ray and they said, yep, that was fine. And I thought, well, they're too, I know surgery, they like to do the EKG, they do a chest x-ray. So there again, if I was needing surgery, at least those steps were done. By like 8 a.m.-ish or so, my doctor stopped in. And she mentioned that, okay, yeah, she did see the blockage in the middle of the small intestines. And it could happen because of like scar tissue, adhesions, that probably happened during radiation. So sometimes intestines can get twisted and whatever. This just seemed like it may have been just a little bit of a narrowing. And this happens to like 30% of patients that have colostomies. I'm like, well, I went 9 months with an ileostomy with no blockage, and I was so excited, and because I understand that you get more blockages with ileostomies than colostomies. And like, here I've had my colostomy, you know, 6 weeks, and I get a blockage. Granted, in hindsight, there were probably, you know, other factors in that too. One, because I was laying for pretty much 6 weeks. You know, I wasn't up and about and walking. I wasn't living my normal life and moving. You know, laying a lot. So eating and then laying, and doing my little bit of walks, but I was in pain. I was still healing. My stomach was healing. And so, you know, there wasn't a whole lot of movement, whereas with the ileostomy, it was still pretty much normal life. So that could have contributed to part of that, again, lack of movement. So she said that, you know, the NG tube clears out 60% of these blockages. It was nothing that I had done. It wasn't anything that I ate, which is good, because I'm like, I'm going to be, you know, afraid to eat after this, because how do we know? How do we know what it was, unless you're going to find a chunk of something in there? And, you know, being that it was in the middle of my small intestines. And then she was like, yeah, it just happens sometimes. So we're going to try the NG tube and have it in for the weekend. That was Friday. So Saturday, Sunday, she said her colleague would be on over the weekend and would know kind of what to do, but she would, Dr. Myers wanted to do like a contrast study. So they put contrast in your belly to go through the intestines and all that, and take imaging, which is X-ray imaging, to see where the contrast is, make sure that it can go all the way through. And so I thought, okay, well, let's see if they're gonna, you know, that's gonna happen on a weekend. Otherwise, I'm having this NG tube in me, which is not pleasant. The NG tube made me so mucousy, and if I tried to talk, I couldn't talk. So I was whispering the whole time. And then one nurse would put it in when she came before she was, you know, she was saying goodbye, and she goes, "Are you whispering because of the tube? Can you not talk?" And I'm like, "Yeah, I can't talk." And the mucus production. I was just so mucousy. I was trying to swallow, and I could barely swallow. It was all just, I'd swallow, and the mucus would be right there again, and they can feel the mucus in the back of my throat. They got me some throat lozenges. I tried that, numbed my tongue out a little bit for while I was sucking on it. Didn't do anything for the throat. They talked about having some spray, so the chloroseptic spray or whatever. Well, 3 different doctors had asked for that for me across 3 different days or whatever, and then one of the nurses said, yeah, the pharmacy doesn't have any. You know, if they would have talked to us, we would know that, you know, they can't get it. So I had my husband go stop and pick one up. By that time, though, it was like near the end, I'm like, I don't know if I can handle this, if I'm going to be, you know, if it's going to make me more mucousy or more, I don't want to put something else on top of what I'm already dealing with. So I just kind of let it be. So I have it now, but hope to God I don't need it ever. Maybe for a cold or something. I'll give it to my daughter. But in any case, so they were going to leave it. They said that, doctor mentioned that the stomach produces a liter of acid a day. So that's also part of why they put that tube down there, to keep all the acid cleared out, so that that's not also trying to go through the intestines and get out. So that kind of made sense. Then I'm like, all right, well, so obviously I'm going to have this tube for a while, which, like I said, it hurt so bad going in, and just so, the swallowing. If I could swallow, it'd be fine. They prescribed fentanyl for pain medication for me. I tried that. That maybe took the edge off of the throat pain, but I still had throat pain. It wasn't enough. It didn't really do anything as far as I was concerned. By 4:30 in the afternoon on Friday, they finally got a room assigned for me. So that was nice. I was on the 12th floor. I was on the top floor over there. Had a beautiful view. It was just like, again, my dad was watching out for me this one because I had the beautiful view of the city, and he used to work at Allen Bradley, and I could see the Allen Bradley clock tower out my window. So I got the chills right now. So that he was letting me know that, again, he was there watching out for me as much as he could. So that was nice that I had a very nice view. Then I had it for a couple days, and then it got really foggy for like 4 days. And then there was like no view. But that's okay. That was okay too. So Saturday, I had my surgeon's colleague came in to see me, and she said that I could have sips of water and some ice chips. So I was so excited. Because I'm like, man, again, the things you don't realize you take for granted. That with having that tube down my throat, I'm like, I just can't wait for the day that this tube comes out and I can have a normal sip of water. That is just going to be so wonderful. And so when she said I could have ice chips and stuff in a little while, I'm like, oh, she's like, don't go crazy. All right, but I got the ice chips in the water, and I had a little bit of a sip of water, and like, well, that was actually almost too much. I'm like, ooh, I really have to take tiny sips, because again, trying to swallow. And then it was like later that day or the next day, like I swallowed a little bit wrong. And then I kind of choked a little bit and stuff. And then after that, I had to like clear my throat constantly. Every time I was going to swallow, just kind of like, and then I'd swallow. And then because I try to get the phlegm out of the flap ear, whatever. I'm like, oh my Lord. At that point, I was a little discouraged. And when I put a picture out to social media and all that, I'm like, I'm a very positive person. I can take all of this. Again, I understand it is what it is. Take it day by day, try to do my best to get through it. And with that tube in me, and knowing it was going to be in there for how many days, it was like, I was defeated. I was deflated. I'm like, you know what? I need your guys' prayers and positivity, because I'm done. And so again, I had, all of you guys, I post on the community page on YouTube, post on Facebook, and probably Instagram. And I got a flood of prayers in again, which again, thank you so much, because it helped. It really did, because I was at a low. And then I got better, kind of got over. I'm like, all right, so so be it. I know the doctor was kind of concerned. It was funny, on Saturday she was concerned at how dark the output was that was coming out. So I doing like stomach acid. Who knew it was like a dark brown color? So I don't think about it, I guess, when you're throwing up. I thought about it later. I'm like, oh, it could be like peachy. It could be kind of brown. I never thought of stomach acid before. But then they ordered me some Protonics, which is a stomach soother type of thing, I guess, to help irritated stomach. So they ordered that. I don't know, didn't change the color or anything at all, and I wasn't having any stomach pain, so that was all right. What else? The pain finally stopped by Saturday afternoon, so that was good. Sunday, I know the doctor stopped in again, and she said, as far as she was concerned, the NG tube could come out. that things seemed fine, the x-ray seemed fine. And I said, well, but my surgeon mentioned she wanted to do a contrast study. And she was like, oh, she wants to do that? Okay, well, never mind then. Yeah, we'll keep that in and we'll do that contrast study tomorrow. We'll go from there. So, okay, good. I'm glad I knew that. And I mentioned that because, again, you don't want that tube taken out if you have to put it back in. And somebody kept saying, it's like, you don't want this out until you're absolutely sure that it needs to come out. Oh, Sunday I had asked then the nurse if I could try Tylenol for pain. If they had any IV type of stuff. Because, again, I'm, can't swallow Tylenol pills. And so she was like, yeah, we have some liquid Tylenol. Okay, cool. So she brought in, brought one of those little medicine cups. Had the liquid Tylenol in there. Nice orange or red, the red cherry flavor, whatever. And I took a little sip and I started sputtering. It was so syrupy and sweet and thick and it just coated. And I'm like, oh my God. I'm like, I don't even know if I could swallow that. And I can't really even swallow water to help wash it down because, again, I was having a problem with swallowing water too. So I took another sip and then she was, I can put this through your IV, through the NG tube. And I was like, oh, that would be awesome. So thank God they come up with a solution for that. So she, through this NG tube, there was a way, they take a syringe, she kind of flushed the tube with some regular water, which I could feel in my tummy. Made me feel like I had a glass of water. It was like, oh, okay, a little cool and refreshing. And then she put the Tylenol down and then did another little flush. And that helped. That actually took the throat pain away. So, again, good to know. Something, for you guys to know of that the really high dose of pain medication didn't really do it, but regular Tylenol, that took away my pain for me. So that was nice. Got a little bit of relief from that, and then I could at least, sleep for, a while without having to swallow. So that was good. On Monday, my surgeon came to see me and talked about that we're going to do the contrast study. So that happened, she had put the orders in, and that happened in the afternoon. Where again, they take this NG tube and they put in, like 200 milliliters of fluid. It was a lot. And I thought to him, like, oh boy, you're just putting in that Tylenol and all that. I could feel the water in my stomach. And at one point, the one time I did that because I had a couple doses of Tylenol, the one point I almost could feel stuff come back up my throat. So I'm like, I haven't eaten a day, I don't know how small my stomach is. But she took syringes full, and it took like 4 syringes to get through it. She did 2 pretty quickly, it was okay. And the third one, she nicely went slowly, and I sat up as straight as I could to make the most room. That went fine. Got the 4th syringe, I got it all in. And I was like, yay, woo, I got that all in. And then within hour and a half-ish, I think transport came up to get me, so in a wheelchair. So I got in the wheelchair, took me down to x-ray. They took an x-ray of me, took me back to the room. I was supposed to have another x-ray within another hour or so. And within half an hour, I got belly pains. I got the same type of pains that was what kind of took me to the ER. That it hurt so bad across the stomach, and it was just kind of rolling pains, but pretty constant. So the floor doctor happened to stop in, and he had been in earlier, whatever, too, and the day before, and saw me, and I was, okay. And he came in and he goes, oh, you look miserable. He goes, that's not good. He goes, have you had any pain medication? And I was like, well, no. He goes, take the pain medication. He's like, there's no reason you should be in pain. He's like, and let me ask if we can stop this and I can get you hooked back up. So he did. He talked to my surgeon, and she said, yep. So they got the tube thing hooked back up to suction. Because obviously during, when they put the stuff in the stomach, they had to stop the suction so they didn't suck all that back up. But to put suction back on, and as it cleared some stuff up, I was good again. And the pains went away. I was like, okay, yay. Except for now, there's still this blockage, because obviously I'm having all these pains again still. So, we'll see what was going on with that. Oh, and before I actually even did the contrast study, I had an appointment that day. So, the calendar on that Monday, 22nd, I was supposed to have a post-op visit with Emily, the plastic surgeon PA, to check my butt area again to make sure that was healing enough okay. So Monday morning, they were able to put through a message. Actually, Sunday night, my husband went into my live well and put through a message that, hey, we're admitted to the hospital, and if by chance you can come see us, great. If you want to talk to us, call my cell phone because she can't talk. And whatever. So she ended up stopping up and took a look at me and said, yeah, I was healed up. I'm good to go. So I can sit pretty much as long as I want to now. And if I'm feeling pain, if I'm feeling like, again, listen to my body. If I feel it's too much, then take a break, lay down. But otherwise, like I'm good to go now with that. So, yay, I can sit now for as long as I want to pay attention to that per se. So that was good. My surgeon's PA stopped in, Bo, and he said that as far as I could tell from the X-ray they did take with the contrast study, it didn't look any different from the CT that they took the night I was admitted. So they're just going to let the NG tube still go for a little bit and wait for Dr. Myers to look at the X-rays and stuff and see what she thought, where she wanted to go from there. And then when the floor doctor came, I think he came back again. I think the floor doctor came back again a little while later and said that because I've been there so long and I still may be there a couple of days, that he ordered a PICC line for me so that they could get me some TPN, which I was told later by someone was total parental nutrition. I know I've heard the initials TPN. I know it's nutrition that comes through line. For some reason I was thinking it was white. Like, you know, a vanilla Ensure drink or something. But anyways, he ordered that, and I'm like, I have a port. Please use the port. It's there. No. You know, they don't like us to use the port. The oncologist teams, you know, don't care for that, and it could get gunked up. So they don't really, and you know, the infection, could get an infection because, you know, or you're in hospital, and I'm like, good God. It's part of what the port line is for. It's, you know, to help prevent me getting stuck so many times. So of course, being in a hospital too, you know, every morning at 5 a.m. you got to get stuck in here. So I was stuck 4 times in each of, you know, my hands of getting blood work every morning. And then I think once I had some little bit extra. I'm like, I've already been stuck today, please. So with the PICC line, they can do medications, you know, IV medication, obviously the TPN line, and they can draw blood. So with the PICC, there's like two ports that goes into one tube. So the PICC line team came up a little bit later and kind of told me their spiel of how this all works, what they do, because it's another one of those where they go into a main, I guess, vein, and it has to go up and around and go into your heart, just like the port. And so again, I'm like, okay, fine, really? I didn't get this. And the TPN also comes at like 10 p.m. at night, so I wasn't even going to get it that night because it was already too late in the day by the time they ordered the PICC line and all that stuff that I would get any medicine that night. So I was just a little down in the dumps with that. I bawled my eyes out for a little bit, just knowing that I'm like, again, it's another procedure I have to go through. And so they're like, well, you could wait till tomorrow if you want to, because tomorrow you're getting your stuff. And I'm like, Wayne's like, or you could do it now because they're here. And I'm like, let's just get it done. Let's do it. So then the gal like took my arm and she's like, okay, let's put this up over here. But I'm like, oh, my shoulder, ow. So I got into a comfortable position that she had to like tie it up to the bed or whatever so I wouldn't move. And she went into, surprised too, like a vein on the side. So there, as you can see the bruise, they went there, as opposed to, I've seen other people have them like on the top or out, but she had on the inside, which is kind of goofy because then it was against my side, but it was okay. So she did her thing. There were 2 gals that were, working on that. They did their thing, they got it in, thank God, because at one point I thought, I'm like, oh dear Lord, the way she was like brushing on my skin, I'm like, don't tell me you poked through or something, or you have to like take this out and try a different vein and whatnot. But she got through, and I'm like, I already have the port on this side. You sure you want to do the right arm? Do it. Oh yeah, she's hoping that port line will help guide this one around. I'm okay. Again, they know what they're doing, so thank God. It all went fine. I got that in. Left the IV, and I was still getting fluids. Left the IV line in just because it was still working well, and it's all there. And that could go okay. And I thought, tomorrow when I get the TPN, then I don't need the fluids. Then you can take out the IV line and stuff, and we'll use the PICC line. And so that went all right. And then by Tuesday, I only took my vitals. I was down to 110 pounds. I had lost 10 pounds over that almost week. It was a Monday. That was over a weekend. So I came in at 118. I got down to 110. I haven't been down to 110 since probably grade school. It was like, yeah, I have no more weight to lose. So I guess that part of getting the TPN and getting more, actual nutrition in me. So that was good. Tuesday, my surgeon stopped up again, said she wanted to do another contrast study. Try it again and see if it would work. So we did it again. Got all the contrast in me, which was good, and then X-ray actually came to me, which was even better. So they came up, they took a couple X-rays and left, and then an hour later, and she was all like, oh, I see you in an hour, and I'm like, oh, she's pretty confident that she was seeing me. She came back and she took another X-ray, and then she was like, all right, well, I'm going to send these off and see if I'm going to need to come back or not, because we figured they may need, one or two more yet. And so she left, and then I kind of started having some rolling gas pains. And it was like, well, I'm sitting here laying, I'm like, let me kind of time this. So I was counting, and I would have gas pains about like every 3 minutes, and they'd last about 15 seconds. I'm like, again, another one of these birthing things, like this is my year of rebirth, that it's a new me. And so there's the whole thing about, okay, timing of, how far apart are the gas pains, how long do they last, who knows. But it wasn't as bad as it was before. I thought I really wanted to make it until like 3 o'clock when the next X-ray was due, and then I would see if it got any worse, and then I'd go back to getting the suction back on and whatever, and but it passed, and then it wasn't having X-ray, and then finally the nurse came at like 3:30, and I'm like, am I having it? She said no, that the last X-ray had made it all the way through to the bowels, to the ostomy or whatever. So because it had passed all the way through, that's why they didn't need any more X-rays. They could see what they needed to. And they said that it looked like the opening had gotten a little bit bigger. So that was good. I had output later that day, which I thought too, well, from the contrast from the day before, so that had made it through. And I was getting some stuff out of my ostomy. It was filling the bag. So I had a couple bags full of that, which was nice. And I thought, too, that kind of cleared me out. And so that was good. Because of having the TPN, they also started pricking my fingers to do my blood sugars. So they said that was going to happen every 6 hours, because with the TPN, it's like people don't have like allergic reactions to it or whatever, which I thought funny, because I'm like, you're starting this at 10 p.m. Why would you start these medicines at 10 p.m. for people if there's going to be some type of a reaction or something? You want to watch them, as opposed to pretty much hooking it up, and night shift goes on their way. They don't check you a whole lot. But they said something about that the sugars could go wonky, so they have to keep an eye on the blood sugars. So I had another X-ray on Wednesday morning, so they wanted to see again how things looked after doing the second contrast study. And I guess it did seem like that hole had opened up a little bit more. My surgeon and I think her PA were off at a conference that morning. They were going to be back in the afternoon. So again, one of the colleagues came in and saw me and said, according to her, again, everything that she saw and looked at, the X-ray looked good. Everything that was happening with me looked good. There wasn't much stuff coming out of my stomach anymore, nothing through the NG tube into the container. I wasn't having pain in my stomach. So, and stomach seemed soft, I guess. So according to that, everything seemed good. So it was basically up to me. Did I want surgery or not? The surgery was scheduled for Thursday at 2:30. If I was going to need it or not. She scheduled that earlier. So talking over everything and stuff, and I said to him, like, can you do some type of a study? Like, if this comes out like after I leave or whatever, I'm like, in a month, can we do an X-ray, or a couple of weeks, can we do an X-ray and see if things are backing up again, or if no, don't do that. And I said, okay, this was even with that. I'm like, if something goes on, I still have to have the NG tube put back in. We have to go through this whole procedure again before I would have surgery. And she said, yeah, obviously if you're having pain and whatever, then you come in and we take care of it. I think she said some people have this, blockages like 2, 3, 4 times. And then by the fourth time, then they're finally kind of fed up and decide they'll have surgery. I'm like, yeah, if this happens again, he's like, oh, we're having surgery. That's, I'm like, I'm not going through this a bunch more times. That it's like, let's get in there and see what's going on. So, I said, all right. It sounded like they thought everything was good. They were pretty confident in how things were going. So I said, okay, then yeah, we can take the NG tube out. So she said she would check if she could or not, or if Dr. Myers wanted it just clamped off, and I could try eating and drinking with the NG tube in. And I'm like, that's not going to happen. I'm like, I can't even swallow ice chips and water at this point. I've tried, and I choke. So she's like, all right, let me see. And then she came back in like 5 minutes later. She goes, oh, she answered me right away. And yeah, the NG tube could come out. So I was like, okay. So then a little while later, the nurse came in, and she's like, all right, let's get this NG tube out. And I was like, okay. I'm like, don't you need a towel on my lap or something? That she goes, oh no. She goes, well, here. And she gave me a washcloth in case, I guess I spit or something. But again, just the mom and me wanting to be clean. And I'm like, you're taking this thing out of my, throat. And wouldn't it be coated in stuff that you don't want to make a mess on the bed? I don't want it on my sheets and blankets. And I would think you'd put it on a towel. What? So she told me to breathe in. And as I started breathing in, then she started pulling it out, and I was like, oh, and then it was out. And I'm like, okay. So there was no gagging, so I was so excited about that. And it was out. So I was like, woo, nice. So in the meantime, then I had to update everybody because I was so excited. So I'm texting my mom, and I'm messaging my other friend, and then I kind of updated Facebook, I'm sure, and then. So it was like an hour and a half, 2 hours, whatever, maybe 2 hours later, the nurse came back in and she had meds for me and whatever. Well, one of the meds was a drinkable, crushed up something. I'm like, really? I haven't even had any water yet. Nobody even offered me in reality after the NG tube came out to have a cup of water. And again, I hadn't really thought about it because I was just so excited. I was updating everybody. I'm like, I haven't even had any practice. And she didn't even say anything. She goes, oh, here, it's orange, so it should be okay. And she just gave me that cup and then she left. I'm like, okay. I'm like, really? These people that prescribe these meds and whatnot, obviously have never had an NG tube. How this is going to go? Knowing that, okay, I wasn't doing so well before, even with the tube, I'm like, okay, I still have to practice. So then I waited for my husband. He finally got there. He poured me some water, and so I took a little sip, and it was okay, but it hurt from where the tube had scratched. It was a little painful.
Well, here we go. 1, I kind of have a voice. I can talk now. I'm not just whispering.
Yes.
2, I am going to have my first sip of water. So, here we go. Cheers. Pretty good. Almost got stuck there. Make me have to cough, but that went down. It'll get easier with time, so yay.
And then I had the surgeon come in a little while later. She was done with her conference and all that, and then she stopped in and she's like, how's it going? You had any output? And I said, well, no, nothing yet. No, that she was like, well, for now, let's just do water, ice chips, and Italian ice. And so, okay, start with that. That's fine by me. And so that's what I had. And that was okay. And then, what else? Oh, after that, because the NG tube was out, I mentioned to the CNA, when she came, I said, earlier in the week, somebody had mentioned something to me like about a shower, if I wanted a shower. I'm like, is that possible? Is that because now I have this PICC line in, and I know PICC line can't get wet. And she was like, oh yeah, she's like, we can do that. Let me get the nurse. So she got the nurse, and the nurse was like, yeah. She goes, well, you have 10 minutes. I can only turn the TPN off for like 10 minutes, and and then it's going to be beeping. I'm like, okay, let's go, let's do it. I'm like, I won't wash my hair then. It's fine. I'll wash my body. And I'm like, okay. And part of it, you also have to cover this up, which they did have a special covering for it. They little clear plastic bandage thing. So the CNA got that all taped up on me. In the meantime, I'm like trying to strip my clothes while the CNA very nicely turned on the water to warm it up for me. It's awesome. She had a new gown and got some towels in there while the nurse was goofing the TPN or whatever. So it was pretty much good to go. I'm like, I'm stripping on the way into the bathroom. got in a little bit of shower. Wayne nicely helped me. So at one point I wet my hair, and I kind of was like, to put this hand up to kind of, and then I was like, oh crap, water's going into the, because they didn't tape the bottom part. And I'm like, all right, whatever, hand down. And so I said, Wayne, help me wash up. And then we, stopped, got it all dried off. Got it. In the meantime, the machine was beeping the whole time. I was like in there, and just, a beep, beep, beep. So not the loud ones that they really like are the alarm type of beeps that let them know that they need to do some action. But it was something, and I was just like, okay, whatever. And then I, get back in bed and all that, and then about a half an hour, and then she goes, okay, I have to turn the TPN off for half an hour so I can do blood work on you, because they have to stop that because they take it again through the same, where the PICC line is, that, kind of goes through the same area. So the TPN has to stop, so it's kind of washed away from the area so they can get blood. And I'm like, oh, so you can do it for half an hour, huh? So again, whatever, they have to do their job. They have to do what they need to do. So, so we got that done. And yeah, and then my husband and I took a walk in the halls because too, I didn't have the NG tube in, so I didn't have to worry about how goofy it felt in my nose or stomach. And so we were able to take a walk. And then a while later, I would mention to the nurse also, I said, we were also supposed to have an ostomy appointment that day, because we wanted to again check up on if we were cleaning the ostomy all okay, and make sure whatever parts I was seeing that it wasn't part of the barrier ring, or what was going on, or if there were stitches showing, or. And so she was like, yeah, I can put that note in for you and everything. I was like, cool, because I mentioned it to my surgeon and stuff, and she said, yeah, have the hospital nurse come see you, because we were going to see the nurse in her office, and she's like, just have the hospital nurse come. So they did. So she came up in the afternoon, and that was wonderful. And she's like, hey, you want me to change this for you? I'm like, yes, please. And it was the one that we've had before. So it's the one I saw who originally marked me for the ileostomy, and the one who changed my bag in the hospital after that 6 weeks. So, or 2 weeks. Week. I was in there a week. She changed it out before I went home. Anyway, so that was nice. So she took the bag off and she saw it, and I said, yeah, we always have this layer of something that goes over the stoma. And she took a look at that and she was like, yeah, this is odd. It was very interesting. I don't know. It's like she'd never seen anything like that before. And she goes, my guess is this is mucus. So she took 3/4 of it off, part of the thing, and as she was taking it off, the stoma started bleeding a little bit. She's like, okay, I said, yes, this is what happens to us. This is kind of the norm. She goes, yeah, this is the norm for you. Obviously, you have a sensitive stoma. She goes, no, it may change in a couple months, but for right now, this is what's going to happen. So she goes, don't tug too much, don't scrub it too much or anything. Just gently try to get stuff off of there, and otherwise, just kind of leave it. If you do have some bleeding, put it like around the outside. Just put some pressure on there for a little bit, and then you'll be okay. Don't need to get it completely clean. It'll be okay. And so I'm like, okay. So that was good to know. It was good to have professional eyes on it and see what she could see. And like I said, she left some of the stuff on there, and we got me all hooked up with that new bag and everything. It was awesome. So that was really good, and got that one checked off. So that was nice.